Hold the 1112 Explorer with the modified pen grasp. To review, the instrument handle should be resting here against the side of your middle finger next to the fingernail. When you're exploring lightly, this finger may be relaxed. That's a relaxed modified pen grasp. But when you are applying a little more pressure to the tooth, you're going to straighten out that index finger and grasp the Explorer more firmly. You don't want to hold it with a really tight death grip of a grasp, because that will make it difficult to detect calculus. So sometimes you're going to be using a moderately firm grasp like this, and sometimes you may wish to relax it to get a lighter touch. This instrument, the Explorer handle, is going to rest here between these two joints most of the time. And then again on the anteriors, it's going to be up high, close to this joint. And when you get to the posterior areas, it's going to go down a little further. Usually you don't want to go past the bone on this part of your hand, though. So this is the modified pen grasp for the ODU 1112 Explorer.
Motion activation to move the pencil tip or probe by rotating your hand and wrist away from your body. During this movement, your ring finger should remain motionless, pressing down against the countertop. Return the pencil or probe to the original position by rotating your hand and wrist back toward your body. Practice making this wrist activation motion several times. Adaptation is the positioning of the first 1 or 2 millimeters of the working end's lateral surface in contact with the tooth. A working end has 3 imaginary sections. 1. The leading third. 2. The middle third. And 3. The heel third. The leading third of the working end is always kept in contact with the tooth surface during instrumentation. On curettes, the leading third is termed the toe third of the working end. On sickle scalers, the leading third is called the tip third of the working end. Adapt the tip third of a sickle scaler to the midline of the incisor. Note that the middle and heel thirds of the working end are not in contact with the tooth surface. Now, adapt the middle third of the working end to the tooth. Look carefully at the instrument and note that the tip third is no longer in contact with the tooth. In fact, it is sticking out. Obviously, this is an example of incorrect adaptation. In this position, the sharp tip is likely to cut the gingiva. As the working end moves around the surface of the tooth, it is necessary to turn the handle to maintain correct adaptation. As the working end moves onto the mesial surface, correct adaptation involves keeping the tip third of the working end in contact with the line angle of the tooth. Now, adapt the middle third of the working end to the mesiofacial line angle. Adapting the middle third is a common instrumentation error when moving the working end from the facial to the mesial or distal surface. Can you see why it is vital to always keep the tip third of the sickle scaler in contact with the tooth surface? In summary, to avoid trauma to the gingival tissue, it is important always to keep the leading third of the instrument in contact with the tooth surface.
Going to adapt this to the distal of the second molar first, and we make strokes by rocking back slightly on the fulcrum, and then rotate your pivot a little bit to rotate your handle toward the lingual. We're doing vertical strokes up the distal to the contact. Now come out and then use your thumb to roll the tip onto the lingual surface now, and then we're going to start with oblique strokes across the lingual. When we get to the mesial line angle, roll this instrument with your thumb, roll it with your thumb, and come around the mesial and do vertical strokes on the mesial. Now we're going to come out and adapt again. You readjust your fulcrum a little bit, adapt to the distal, and then do vertical strokes on the distal surface. Come out. I just use my thumb now to roll around, and I move my fulcrum over here a little bit more toward the anteriors to position the tip. I'm feeling with the first few millimeters of the tip of this Explorer, and my thumb has to roll a lot right there to adapt to the mesial. And I rock back very slightly on the fulcrum. And then we're going to pretend on this Typodont to insert it subgingivally, and then we're going to activate very small oblique strokes across the buccal surface. Let's try that again. Insert at the distal line angle and use oblique strokes across the buccal surface. When you get to the mesial line angle, use your thumb to rotate the handle in your fingers. You use the thumb against your middle and your index finger and adapt to the mesial, and then activate vertical or oblique strokes across the mesial. We take it out and then adapt at the distal line angle. Gently insert this subgingivally, and when you get to the base of the pocket on a real patient, it'll feel like a taut rubber band. We're going to adapt, and then again doing a slight motion, moving on the fulcrum. We're going to do vertical strokes across the distal. Sometimes you do straight vertical strokes, and sometimes you'll be doing oblique strokes, but remember to keep the first millimeter or two of the tip of the Explorer against the tooth. So continue practicing across the buccal and on the mesial and the distal with the 1112 Explorer. Explorer here on the facial of the left canine, and then I rotate around. Now right here, if I stay with my fulcrum in this position, I'm going to cross over very severely across this mesial surface. So you want to drop your handle and upright your lower shank first, then rotate around, and then keep this lower shank really parallel to the surface that you're exploring. So we're going to move the handle over toward our body as we do this to rotate this lower shank, or keep it over so that it will stay parallel to these mesial surfaces. By establishing a fulcrum over here on the right side, and then we're going to start on the facial of the right canine with very small overlapping strokes, and then we're going to come over to the mesial of this tooth, and I have to lean my handle over. You see how I'm moving the handle over to upright the lower shank. We'll do the next tooth. Start on the facial with very small overlapping strokes, rotate around, and then again upright the lower shank as you come around. And we'll do the next one. Rotate around, upright the lower shank.